This task force will bring together the best information and expertise possible to aid us in creating law enforcement strategies that stymie the illegal trade of prescription drugs, public health strategies that help us prevent, deter, and treat prescription drug abuse, and legislative action that aggressively takes on this problem. The task force will include officials from public safety and public health, from medical and pharmacy backgrounds, from local, state, and federal governments. It will regularly report its findings and recommendations to me and to leaders of the General Assembly. I am committed to working with the General Assembly on any legislation, including a licensing program for pain clinics that we need to help us combat prescription drug abuse. And there have already been introduced a number of legislative initiatives, and we will work with the legislators as we together attempt to deal with this problem. Now, one of the important tools that we already have is the prescription tracking database that we call Ohio Automated RX Reporting System, or ORS. All pharmacists report into this system, but according to the Pharmacy Board, only 1 in 5 actually use the system when filling prescriptions. So today I'm calling upon all doctors and pharmacists to check ORS each time they prescribe or dispense an opiate or opiate derivative. I'm also asking the task force to pursue strategies to increase the use of ORS by doctors and pharmacists. Local law enforcement is on the front line combating this epidemic, and we want to help them. So today we're setting aside $250,000 in justice assistance grants that local law enforcement can apply for to expand or to improve their efforts. The Ohio Department of Health has compiled important information on the prescription drug problem on their website, and I invite everyone concerned about this epidemic to visit the website. The address of that website is www.odh.ohio.gov/drug overdose. As I said, I'm happy to have with me the individual who will chair the task force. That's George Maier. And the vice chair of the task force, obviously, will be our director of public health, Dr. Jackson. At this time, I'm going to ask our Attorney General if he would like to say a few words.
Thank you, Governor Strickland. I attended a meeting of our drug task force commanders throughout the state as part of the BCI, Bureau of Criminal Identification Investigation, late last summer. And what I heard in that meeting was sobering. Law enforcement, sheriffs, police from around the state told us that there's an epidemic of prescription drug abuse. It is people who are addicted to drugs, but it's also young people who are using this as a gateway to becoming addicted. The number of fatalities from prescription drug overdoses is shocking in some counties. It is a larger cause of death in America today than traffic accidents, which is a notable fact. We recognize that every household in Ohio needs to understand that their home is becoming a danger, unnoticed or unremarked by them, but it's a danger if they are not securing and disposing of their prescription drugs in a sensible manner. We have put together a pamphlet that we are distributing through the schools and through sheriff's offices that we think every household in Ohio needs to have, explaining the dangers of prescription drugs, explaining how important it is for them to secure those drugs in their medicine cabinet and dispose of those drugs when they're finished with them. These are ticking time bombs in our homes if they are not carefully thought about and secured. In addition to that, the problems that the governor highlighted of the pain clinics and the pill mills are very real. And we need to have better compliance with the WARS system. And medical providers need to understand that if they do not get to better compliance on their own, there may well be legislative action and a mandate imposed, which they may not want, but it's going to be important to protect the public safety that we get better compliance with that. In terms of our efforts ongoing, the Organized Crime Investigation Commission is working on this problem with task forces in various parts of the state. And the Bureau of Criminal Identification Investigation, through our drug task forces, is working on this problem as well. In addition, we do prosecute both Medicaid fraud and healthcare fraud more broadly in my office. Last year we indicted and convicted more than 200 individuals around the state. When it is brought to our attention that people are abusing the system, gaming the system, faking prescriptions, or prescribing where it is not justified, we will indict those people and we will prosecute them. But more needs to be done on this problem. There are people who are addicted to drugs or who are developing addiction to drugs who are cycling right now among methamphetamines, heroin, and prescribed prescription drugs simply based on what is most accessible to them and what is least cost. And in different parts of the state at different times, it's different things. But this is certainly a big part of the problem. People think these drugs are safe or safer because they were not obtained on the street. They were obtained from a licensed medical professional, but they're wrong about that. This is a leading cause of death, and I applaud the governor for this task force. We look forward enthusiastically to participating on it.